G'day, Ashley here. I'm just putting together this video to help break down what happens to a new patient when they come into our clinic. This isn't just for new patients, but for those of our regulars who might wonder why we ask so many questions and why we might ask questions along the way. So as you come in the front door, you'll get given a new patient file. It's got lots of different questions on it, and some of it may not seem very relevant. It's really important that's answered accurately and honestly, because some of those questions may inform our decision-making processes as we go along. After that, the chiropractor will take you to their room. They'll run through the front of that form with you, then they'll take a patient history. That is, they'll ask why you've come in to see us and what's happening. Then they'll ask a lot of clarifying questions to help narrow down exactly what could be happening. At the end of that process, they'll have a list of possible diagnoses in their mind. That's a really important list, and we call that the differential diagnosis. After the history, we'll do an examination. So it'll be a tailored examination for you and that differential diagnosis list. It'll consist of some neurological and orthopedic tests, and the sole purpose is to weed out that differential diagnosis list and try and form a singular diagnosis. At the end of all of that, if we don't have a single diagnosis in mind, we might have to take an X-ray here or refer you out for further imaging or get some further tests done. When we collate all that information together, we'll sit you down and have a chat, talk about what we found, what we suspect is happening, and what we want to do next. And that could be some further treatment, or it could be a referral to a more appropriate healthcare provider. There's more information on our website, and I'll link that down below. If you do have any more questions, pop them in the comments and I'll get to them when I can. Thanks.